Peel Region Public Health is under fire right now. They issued guidelines instructing parents to self-isolate their asymptomatic children, so keep them completely separate from all members of the household for 14 days if they have been dismissed from school because someone in their cohort has COVID-19. Parents say it sounds more like a punishment, as Peel Health says it was an oversight.
We're not talking like a 16-year-old teenager who wants to be alone anyways, regardless, in the room, and can call out to you if they're, need something. But we're talking little children here, and this is what really bothered me about it.
This Mississauga mother of 2 elementary students is one of many shocked by the flyer, which was handed out to parents whose children attend Peel schools. The guidelines lay out what you should do if your child is dismissed from school or childcare. It suggests they should stay and eat in a separate bedroom, use a separate washroom, and essentially stay away from all members of the household. What's missing is key language that mentions the child's caregiver.
This is what really kind of bothered me about all that is making them feel kind of isolated and not cared for. And as a mom, I just couldn't see that happening.
After some online backlash regarding the harsh recommendations, the Region of Peel issued this statement, which reads in part, "We made a mistake. We left out an important detail."
As a parent myself, I can't imagine any parent isolating a child for 14 days in a room. It's the psychological and emotional effects of that. It made no sense.
Brampton Mayor Patrick Brown says he reached out to the Peel Medical Officer of Health after receiving a number of complaints from parents.
There are recommendations on our website with a recognition that children cannot self-isolate, and they do need to self-isolate with a parent or guardian. It is important that these guidelines were done with the best intentions, with a recognition that household transmission does continue to be a significant source of spread in our community.
Ontario's Associate Medical Officer of Health also weighed in on the controversy today. Dr. Barbara Yaffe says while it's important to limit exposure, the child needs to be taken care of.
Hopefully only one or two people need to care for the child during that period. But you do not leave the child alone in a room for 14 days.
The Region of Peel says they will have a new handout to share with parents and guardians later this week. But for now, they do have updated information on their website as to how you should care for your child if they are sent home. In Mississauga, Maleeha Sheikh, City News.